Tony is with the experts at the Kansas City Vascular Institute, breaking down how you can protect yourself from peripheral arterial disease. Take a look.
We're here at the Kansas City Vascular Institute to talk about some of those everyday health conditions that can lead to something very serious. I'm talking about peripheral arterial disease. I'm joined by Dr. Juan Carlos Correa, who's going to tell us more about it. How are you doing today?
Thank you for being here. So peripheral arterial disease is a chronic condition which is the buildup of plaque inside arteries. It can lead to very serious consequences, such as possibly losing your leg.
Just discussing some of those everyday health issues that a lot of people face, diabetes being one of them. Yeah. How can diabetes kind of, affect the arteries?
Imagine if you've got your kitchen sink and over a period of time, instead of putting a little bit of sugar down that sink, you put a liter of very sugary water. You're going to clog up your sink. The same thing with high cholesterol. And smokers, imagine you've got this tarry fluid you're putting down your sink. You're going to clog it up. You do that over time, you end up with peripheral arterial disease.
Yeah. Okay, now you talked about some of the examples that you're going to show us. Let's first see what it looks like when the diabetes starts to affect the arteries. Show us what you have here.
Absolutely. So this is, to do an example, imagine that inside your arteries with blood flow going through, everything's going fine. And we have our smokers. More than 90% of all tobacco products in the US actually have tar or tar-related products. And this is an example of what would happen if you consume a little bit of these products. That buildup of tobacco products inside of those arteries will connect, build up on the inside of that artery and stick to it. Our body, in a process of defending itself, will form plaque. And that plaque buildup over time will eventually clog up that artery. Also added to this, we have our patients with high cholesterol, patients with diabetes, and you've got those saturated fats that are behind their blood, patients that are not on the right medications. And the same thing, that buildup of cholesterol and everything going down those arteries will do the same thing. It will cause that chronic buildup. And over time, it will clog up the arteries.
Just mind-blowing there. So now, diabetes is something that could be passed down. It could be genetic, right? Talk about how genetics can affect the arteries too.
There are some diseases in which you can pass it down. I give again the example that some people live in a neighborhood where they have hard water, and it's not their fault that their kitchen sink is going to have that calcium brine buildup. That's a type of genetic disease that some people also have, where they have that genetic predisposition to clogging arteries. Now, if you add to that the lack of activity, if they smoke, if they have high cholesterol, if they have diabetes, they're going to develop a process that actually looks like that yellow buildup that we have here on the diagrams. That buildup of plaque. This is peripheral arterial disease. And this is something that we treat here on a daily basis at our office. We do it with medicines, we do it with wires, catheters, and stents, where if need be, I take these patients somewhere for surgery.
Now, doctor, if somebody is in need of this treatment, how can they get in contact with you?
Well, if they go to our website, kcvi.com, one, they're going to learn about all the treatments that we offer, but they're also going to be able to schedule an appointment and see how is it that we can best serve them.
Well, thank you so much for the demonstration and just all of the education that you brought forth to our viewers. Now, if you at home are watching and you're in need of this treatment, all the information that you need to know is listed right there on your screen.